Let me introduce Dr. Maya Moody. I am so glad that she's here. I've had the opportunity to get to know Maya for many, many years. We did training together at the University of Missouri and have worked together in lots of different capacities over the years. And so it's certainly awesome to have her here with us today to talk about how essentially what is neurodiversity and how do we make sure that we are providing neuroaffirming care, especially if you're a clinician, but honestly, I think even as a parent or as an autistic individual, you're going to learn a lot through this next talk from Dr. Moody. So let me introduce her. Dr. Maya Moody is a neurodiversity affirming pediatrician in St. Louis, Missouri, and the parent of a neurodiverse 11-year-old. Through her personal and professional experiences, she's taken a deep dive into neurodiversity and the movement around that, and is a proud partner and advocate for neurodiverse individuals. Dr. Moody also is an incredible advocate. She's the current president of the American Academy of Pediatrics Missouri chapter. And frankly, she, again, is just a leader in so many ways and so many opportunities that she has to be a voice for kids, particularly kids who are in need. And so I'm really delighted for us all to be able to listen to her for the next 45 minutes or so. As always, you'll have a chance to ask questions in the Q&A. We'll do our darndest to be able to get through as many questions as we can. But as always, please listen in, keep your ears perked for things that you might want to think through as that relates to your own practices or your own lives. And after, we will have a conversation together about that. So Maya, over to you.
All right, thanks so much. Good morning. Well, for me, it's morning. Recognizing that we have lots of folks. So thank you so much for joining and for having me. I really am excited to present today. So I am going to be talking about the neurodiversity movement and advocating for neurodiversity affirming practices. Dr. Soul gave me a wonderful introduction, so I don't have much else to tell you about myself. So we'll just go ahead and get started. So today we really want to talk about neurodiversity, defining neurodiversity, neurodivergent, neurotypical, and really think about inclusive language when discussing all of this diverse thinking, feeling, and behavior patterns in children, because we want to really reduce that stigma and kind of normalize these neurodiversity traits. We also want to explore opportunities to expand their understanding of neurodiversity and how we can maybe have this reflected in our professional practices with really thinking about it as an equity and inclusion lens. So what is neurodiversity? Neurodiversity, it describes the idea that people experience and interact with the world around them in many different ways, and that there's no right way of thinking, learning, or behaving, and that these differences should not be viewed as deficits. And the Dr. Nicole Baumer and Frew have a wonderful blog post there for Harvard, and really kind of diving more into this thoughts. So this Autism Sketches, Autism Spectrum cartoon appeared on, man, Kristen, I can't remember if it was you shared it with me, like on social media or something, but this was my first introduction to the world of autistic artists and neurodivergent artists. And so I have had the opportunity to reach out to everybody who I have displayed in this presentation and in these slides, and have either purchased or have permission to share. And I encourage all of you to really look at these artists. They're an amazing piece to the neurodiversity movement and have such incredible ways of telling us information and things that it's just easy to digest, easy to understand, and it really is enlightening. So, but this Autism Sketches, autism is not linear. And when we're thinking about, more autistic, less autistic, that we really need to think about it as a spectrum, not only in individuals, but within the individual. So things like the social differences, difference in the intense interest, the sensory, all of that may differ and in every child every day, and differs between each, child. So, you've seen one person with autism. We've seen one person with autism on that day in that moment, and that we need to really think broadly about, just like everybody else has waxing and waning, symptoms or traits, that we need to really think about that in a more inclusive sense, and that the second picture there from Little Penguin Studios, where it says we're both autistic, but we have different strengths and difficulties, and so it's more of a blending rather than a true spectrum like the picture above, where it goes into each section. It's more of a blending, and so really thinking about our patients and clients or family members, whoever it is that we are serving, in a little bit more of a broader sense. So the neurodiversity movement really looks to broaden the acceptance of patterns of behavior rather than explicitly categorize them based on pathology. So really thinking about normalizing these behaviors, and not pathologizing them. So just because their social skills are different doesn't mean that they're wrong. They're just autistic social skills, or their autistic communication styles, instead of, or even autistic play. This was something that obviously I've experienced in my own life, but it's really interesting. One of the first things when we were working through my daughter's diagnosis was how she'd never followed directions for any of like the games or the toys or anything. She always like made it up, made something different or used it differently, or, she hated following instructions. And so we ended up getting like more free play kind of toys. And then when I had our youngest daughters, who is neurotypical, seeing how she played with those same toys, but in a very, neurotypical kind of following the typical directions kind of way. And so it's really thinking about that the way that Abby played with them is no different, or wrong than how Evelyn played with those exact same toys. It's just a different way to play. And again, different ways of communicating, different, the preferences for routine can be, respected, and learning again, like while moving and fidgeting. I mean, how many of us really struggle to sit through a day in front of our computer screens, right? So maybe this is all just normal, and it's just in different ways. So again, just normalizing, instead of pathologizing. So the start of the neurodiversity movement was really in the 90s, when autistic individuals were able to connect online, which now is even more prevalent, obviously, and much changed since the 90s. But there were online platforms where these folks could meet and come together and share experiences, and thoughts, and really build a community. And so Australian sociologist Judy Singer is one of the individuals to have coined the term neurodiversity, and thinking about it as a disabilities rights movement to promote equality and inclusion of neurologic minorities. This here, the neurodiversity, a birth of an idea, is her thesis statement. And it's definitely an academic read, but it kind of really shows the start of the thought of the neurodiversity movement. So let's talk about disability, as we were talking about this being a disabilities rights movement. So there's two kind of models of disability I want to discuss. One is the medical model of disability. And this is the one in which, those of us who are physicians or allied health professionals, this is how we are trained, right? We are taught to understand illness, and the loss of function, and that it's a deficit or a defect, and that there is a set of normal, and what falls out of that set of normal is a disability or a pathology or a diagnosis. And so then kind of on the other side of this is the social model of disability. And this makes a really important distinguish in between disabilities and impairments. So disabilities are restriction imposed by society on an individual, and an impairment are the effects. So let's think about this. If someone has an ambulatory impairment, meaning they're in a wheelchair or they need a ramp. So if every building has a ramp to get into the building, then it's just an impairment. It's just a difference, right? But if there's no ramp and there's only stairs, then the disability or their impairment becomes a disability. They are unable to access the building. And so what if we think more about universal design, and instead of it being a coding regulation that every building has a ramp, why doesn't every building just have a ramp and not stairs? Everybody can use a ramp, right? Or giving options of ramps versus stairs. But the ambulatory impairment of being in a wheelchair or a walker is not a disability until there's restrictions that make it a disability. And so what social model of disability is really thinking about is changing society and the planning and the thought perceptions, and not changing the person. So this is again thinking, in inclusion and equity, thinking education, accommodations, universal design. And the Office of Developmental Primary Care at UC San Francisco has a great section about this medical model versus social model of disability. And I encourage you to take a look if you want to learn more. So really, where do we need to bridge these models when we're thinking about neurodiversity affirming practices, right? So we know that a medical evaluation and treatment is important. We know that we need to establish a formal diagnosis. We have to have that diagnosis in order to access the social and medical services, think about co-occurring conditions, and really have a mechanism of explanation for the individuals and their families. So, but really thinking about, okay, so I need XYZ diagnosis to get, XYZ services. Okay. But when we think about what those XYZ services are, or what the services for the diagnosis is, we need to think about what the patient and the family's priorities are. What is making them, what would give them a happy and healthy life, right? So that's what I always say to my neurodiversity families in clinic, but also to anybody across, any sort of culture or age, is what does it mean for you to have a happy and healthy life? So when we think about a diagnosis, we need to put that in the context of accessing services that promotes communication, social, academic, and daily living skills to maximize quality of life and the developmental potential of the individual. So this is where we think about bridging the models. Yes, there's a medical model of disability, but how do we have this universal design accommodations and education to really make those interventions meaningful for individual goals, desires, and needs, right? So we really kind of bridge to think about neurodiversity as biodiversity. So fun fact, I was almost an ecologist in undergraduate. One summer I applied for a medical internship and I applied for an ecology internship, and I got the medical one, so here we are today. However, I still kind of take this ecological view to my practice, actually, and to life in general, but really thinking about the neurodiversity movement to think about autism and other neurodiverse individuals as human diversity and biodiversity, and that we need this diversity to really add to the collective richness and diversity of all of our cultures, to our think about technology, the industry without neurodiverse individuals, to think about the music and orchestra and composers without neurodiversity. So many of our rich cultural experiences, expansions, discoveries have been what we now recognize as neurodiverse individuals. And so how can we really go beyond the acceptance of neurodiversity, but really empower and advocate for neurodiversity as something that enriches our communities? So let's get a little more concrete here as we've talked about neurodiversity, we've talked about kind of the movement behind it. So what are we actually going to do with this? I'm like a super practical person. And so what does it mean to have neurodiversity affirming practices? So the first thing is you got to check yourself, right? So you have to think about your own implicit bias, your own perceptions, what you think may be what this child needs or this family needs to be happy and healthy may not be what they actually need. And you need to understand that you don't always know exactly what's best, so to speak. I had a family once that's not a neurodiverse individual, but who told me, it was early in my career, I was getting all these recommendations. I thought, oh, here's all these resources. This is going to be perfect. And the mom looks at me and she goes, Dr. Moody, I know you know what's best, but maybe I know what's better for my family. And that really stuck with me, like, yes, here's what the evidence says. Yes, here's all of these, services. But if it's not going to work for the family or the individual, then, maybe that's not the best path. So that active collaboration piece is huge with the family, listening and learning from lived experience. I'm such a visual learner. I think that's why I love all of the social media, Instagram posts from, Neuro Wild and Little Penguin Studios and Autism Sketches and all of the other ones that I have in my presentation, because it just kind of like is aha moments for me. And it's really helped me, really understand my daughter and what her lived experience is. And then really thinking about, okay, so we're all here because we're all probably wanting some neurodiversity affirmation, right? So we're already embracing those differences. We may or may not have already had some of these like internal reflective moments about our biases and what we think is best versus what the patients know is better for them. So really thinking about how we can advocate and teach our patients and neurodiverse individuals or ourselves how to advocate for ourselves, to know what the strengths are, to know what we can build on in order for folks to have that improved quality of life that we're really looking for. So really, again, challenging the assumptions of what is normal and what is needed for a person to live well, and really focusing in on the accommodations with a focus in on dignity and self-determination for these kids. So when we think about neurodiversity affirming practice through a diversity, equity, and inclusion lens, what does this really mean? And I have the absolute privilege of taking care of underserved kids here in St. Louis, which includes a lot of immigrant families, lots of different cultures, lots of different medical practice norms. And so in a way that we've done so much work into understanding cultural humility and understanding and respecting all of these differences through all these different cultures, well, we really need to apply that same thing to our neurodiverse individuals about their identity and their well-being. So thinking about, all of these, it kind of looks like a pyramid, but it's not necessarily building on one another. But First of all, honoring all forms of communication, including that behavior is communication, and thinking about how we can improve communication in a meaningful way to help the individual achieve their goals, right? So we may need to adapt some systems and environments, right? But we really need to focus on the individual. We need to think about, just because they live, act, behave differently doesn't mean that it's wrong, right? I say happy and healthy because we want people to be safe, right? So if, yes, there are, times in which an ABA kind of approach is appropriate because we need to keep the individual safe, right? So happy and healthy. But then really thinking about, what is normal, and rejecting this neuronormativity. As I talk to so many of my colleagues about in this presentation, one of the things I hear back is like, yeah, really, like, what is normal and why do we have that? And that questioning is kind of that first step along the way of that neurodiversity affirmation process. So again, really want to focus on the individual, nurturing that self-positive identity, becoming their own advocates, validating their differences, respecting their autonomy, and then understanding all of the different intersectionality that comes across, right? So thinking about a very complicated Venn diagram of who every individual is, be it neurodiverse, neurotypical. And really, again, when we're thinking about this universal design, how every building has a ramp, right? So why can't every person have their own life definition of being happy and healthy? And so I think that really having all of those pieces is so important. And for us that are clinicians, really, again, having this moment of like checking ourselves, and in our this quote in our daily conversations with patients and families, how often do we, as physicians, clinicians, therapists, whatever, in our own individual lives, inadvertently promote negative stereotypes, diminish the patient's self-worth, or portray them as broken individuals or burdens to others. So we really need to think about how we come off, in what we say. And we're probably well-meaning, right? But we need to think about, yes, you want to validate the distressed mother in clinic. Man, this is really hard. I'm sorry this is how you're feeling. But we don't want to put down or diminish that the kiddo or whoever is in the room. And so really just making sure that we're focusing in on the patient and their needs and how we can help them do and be the best that they can in their eyes. So another big piece to the neurodiversity movement, and something that gets pretty sticky, is this whole idea of person first and identity first language. So in a traditional sense, a lot of us, I'm sure, I was trained in person first language, that we say, it is a girl with autism or a girl on the autism spectrum, instead of an autistic person. So one of the things that we learned, or are learning from the neurodiversity movement, is that, some autistic people want to be known as autistic people instead of a person with autism, because they feel that being autistic is such a strong part of their identity. And so this is another great little cartoon strip that says, these are some children with autism. These are autistic children. So person first language, why not ask the person first? So, is there a right or a wrong answer? Certainly not. Again, this focuses on that individualism, and just be frank and just ask the person directly about their language preference. And sometimes it may change. So Abby actually joined me to give this presentation the very first time that we give it. And sometimes Abby wants to be known as an autistic girl, because she feels like being autistic is how she really experiences the world, and you can't really kind of separate it. And then sometimes she says that she's a girl with autism, because even though she has autism, it's not the only thing about her. And so, from the mouth of babes, we really kind of have to think about these things and just kind of respect, but know that words matter. And respecting that individual in that time is really important. So when we're thinking about respect, here is some respectful autism language. So really thinking about how can we change from a pathology, deficit, defect kind of thinking and into a really positive, neurodiversity affirming, normalizing kind of nomenclature, if you will. So here's a great resource in the list, and it's in the resources for you all. But in thinking about a disorder, thinking about it maybe as a disability, but again, recognizing medical model versus social model of disability and what that means. Instead of saying autism spectrum disorder, maybe saying autism or autism spectrum development. A deficit, you can say area of challenge or difficulty. I mean, everybody has challenges. Everybody has difficulties. I, love and appreciate art, but I am not an artist, right? So instead of saying that I am an artist deficit, perhaps I have some difficulty in artistic expression. So really thinking about those differences. Autism symptoms, again, we think of symptoms as a pathology or more of a, that medical model. Autism characteristics, traits, features. And this is hard for me. As a clinician, as a practicing pediatrician, I still get myself stumbled up on this symptoms versus characters, traits, or features. But it is important for us to really think about that. When we think about red flags for autism, you think about red flag, you think about, I picture somebody in the middle of the ocean with this big like danger, danger sign, and so like maybe we don't need to be so alarmist or catastrophic about it and really think about this as being signs or indicators of possible autism. Problem behavior or challenging behavior, distress behavior, again, behavior is communication. Meltdown tends to be, a well accepted term right now in the neurodiversity space. Meltdown, shutdown, burnout, those sorts of things. So, restricted interest, maybe saying focused or intense interest. Comorbid, again, morbid, having a negative connotation to co-occurring. Risk or risk factors, thinking about likelihood or possibility or a predictor of. Healthy controls, again, neurodiverse individuals can be happy and healthy. So saying typically developing or neurotypical. My favorite one, and I kind of added this on the end, but thinking about the rigidity and the inflexibility, is this the individual being rigid and inflexible, or is this the community or society or the culture being rigid and inflexible? So two little quick Abby stories. One is Abby really struggles with eating dinner at the table. Always has, probably always will. So she went through this period of time where she ate dinner under the table. And we really wanted to have family dinners and sit at the table. And this was kind of like our compromise, because otherwise she was melting down and she wasn't eating, and ARFID kicked in, whole 9 yards. But anyway, so she said to me, she must have been 8, 9, or 10-ish, and she said, well, Mom, maybe you're the one that's being inflexible. Maybe you're the one that's rigid because you're insisting that I sit at the table. Maybe that's what's the problem. So, God bless her. She's, has grown up in a neurodiversity affirming household, and she is a very good self-advocate. Now, sometimes we do have to balance that with her social skills. But it was really an aha moment as I was taking this deep dive into neurodiversity affirming practices. You're like, oh, huh, yeah, maybe I am the inflexible one because I'm insisting that she sit at the table for dinner. But she would sit under the table. We would still have normal conversation, like, how was your day at school? Or this is what's happening. Or, oh, hey, you got soccer practice in 2 days. Those sorts of things. She just sat under the table. So again, thinking about, these kind of traits a little differently. So this could be another kind of sticky situation. Sort of like when we talk about person first language versus identity first language, is this high functioning and low functioning and the levels of autism. I really am an optimist, so I'd like to think that the DSM really did try to do the best they could when we went from 4 to 5, and we were thinking about, splitting all of the autism spectrum differences versus now we lump them all together, and needing to think about, if we lump them all together, we've got to have some sort of ability to differentiate, because the spectrum is a spectrum. And so these level 1, 2s, and 3s get very sticky, especially for those of us in the diagnostic space. And then when we're even communicating with others about either your child or or a patient to another allied health profession, or even me filling out Girl Scout camp forms, I have to think very carefully about how I'm going to describe Abby, because it's so easy to be like, oh, well, she's high functioning autism and she's got generalized anxiety disorder. But what does high functioning mean? Does that mean that she has high language ability? But sometimes she doesn't have high language ability and she loses her language when she's like super stressed out. And sometimes, is she high functioning because she doesn't need to stim, and because she doesn't need to spin, and she doesn't need to do all these things to help regulate her nervous system. But those are all outward reflections of the autistic traits, right? So again, here's another one of those artists I've been talking about. Functioning labels really are based on how noticeable a person's autistic traits are, and doesn't actually reflect kind of what's going on inside. So words matter. At the same time, we don't want to deprive patients of their self-determinations and opportunities to reach their potential, nor do we want to deprive patients of necessary supports and services. So while these qualifications are needed, we have to do so mindfully and with intention of what we're trying to communicate. And so it's another one of those situations that maybe it's not right or wrong, but what we need to do is think about our intentions with that communication and those labels. So how can we kind of think about neurodiverse brains differently? Again, as I kind of talked about earlier, how my neurodivergent child played much differently with her toys than the neurotypical child, who later played with the same toys in a very typical way. Here is a little artist rendering of 2 brains, and it says, oh, I've never played with blocks like this before. You have such great ideas. Right. And the neurodivergent brain is, of course, is upside down and is saying, yeah, thanks. So that's just a neurodiversity affirming, instead of like, what are you doing? Blocks go on the floor. You can say, oh, wow, this is totally different. And so The truth is, at the bottom, this says the world needs people who think differently. Otherwise, things will never change and new things will never come about. So how can we shift our thinking a little bit about these challenges, from challenges into strengths? So perhaps, there's difficulty understanding social nuance. And but the amount of the detailed thinking is incredible, right? So maybe, neurodiverse individuals have difficulty filtering all of this like external and internal sensory stimuli, but their memory is incredible. And maybe they have difficulty planning task of daily living, and the executive functioning that goes into just getting through a normal kind of typical day. But the intense complex pattern analysis, when you're thinking about like debugging a computer code and figuring out, so I may be able to like, come home and get dinner ready, get everybody bathed and get everybody to bed and wake up for the next morning and get everybody ready to school and get them out. But can I look at a level of code and figure out the pattern and where the pattern went awry and fix it? No. So like why are the one thing, valued over another? And how can we think about these challenges and strengths differently? So again, we need to think more on a strengths-based approach than building our neurodivergent kids up. So recognizing that these playing into the strengths, giving them a positive identity, having a supportive network, making sure that they're safe and healthy are really the basis for us to be able to build and create a regulatory sensory and nervous system, emotional system, for them to begin to think about regulation and co-regulation. And then it's only after those things that we can help the community, everybody can really look about focusing and learning and having impulse control and planning and being a more flexible thinker, developing language and problem solving. But it is truly built on those things. And unless we have all of those steady foundations, it's not until we get to, that 1, 2, 3, fourth level where we're looking at things that are externally assessed, right? Behavior, skill development, academics. So we are grading kids or people on those three externalizations, right? And so, but in order for them to reach that level, we have to focus so much more on all of those pieces to the tower underneath it. And then thinking about long-term goals, right? So what are, research and therapy and services that are, going to improve the quality of life, and thinking about doing things that can help the kiddo with their communication, minimizing some of those sensory challenges, reducing their anxiety, and really having a shared decision making, and improved patient self-management, patient or family self-management. So I want to throw a little bit in here about masking. One, because I have a female autistic kiddo, and she knows how to mask, and I kept trying. This was a real hard thing for me to kind of understand, until she was verbal and more verbal and could really had that emotional language to describe. And so we so often, when we're thinking about high functioning, low functioning, we're thinking about how autistic a person seems, or you don't look autistic, really, because we are not, if you're not in a neurodiversity affirming environment, autistics will mask, right? So they won't stim because they've kind of gotten to this point where they realize that spinning around in a circle in the middle of a restaurant patio is not appropriate, or normal, right? Or whatever, a social norm. But Abby at the age of 2 did it all the time because that's what she needed to regulate her neurosensory system. You know, masking with scripts and ignoring all of the sensory, kind of just like stuffing everything in instead of letting it out. Doing things like forcing eye contact because we know that's what you're supposed to do. And really not taking care of yourself and being your authentic self. And we know that has a direct implication for the mental health of autistic people, was really predicted by the degree of which society accepts them as autistic and that they can be freely themselves. And so this goes, again, when we're thinking about that intersectionality, this really goes along with a lot of different groups and different folks. And so we really just need to be validating, affirming, and let them know that they have a safe space. So here are a few of my favorite things as I have taken a deeper dive into neurodiversity, really in a lot of the parenting piece and finding my community of differently wired kids or neurodiverse wild kids. The Neurodiversity podcast and Debbie Reber with Tilt Parenting have been really wonderful. And then really thinking about autism in a different way. There's lots, but Uniquely Human is probably one of my favorites. And then if you really want to take a deep dive and totally geek out with me, then the Neuro Tribes, The Legacy of Autism and the Future of Neurodiversity, really digs into the history of autism and kind of where we were and where we're going. So that is my last little slide. Oh, no, I didn't. Okay, changes you may want to make. So really thinking about inclusive language, reducing that stigma. Words matter. Abby, one of the answers to a question when we gave this in person one time and she was with me, somebody said, well, what do you want people to know most about your neurodiversity? And she surprised me. She goes, that I have ears and I can hear too. And I hear what you say about us or what you say about me. And so it really does matter. So thinking about, what we say and what we do and how we qualify or quantify or diagnose or, do our assessments, just reducing that stigma. And then applying strength-based approaches, again, for everybody to grow up to be happy and healthy. And then really validating and listening to the autistic experience and autistic voice. So there are some of the references if you're interested in learning more. And thank you very much for having me.
Awesome, Maya. That was amazing. Thank you so much for a great talk. And, obviously I got a chance to hear you give that talk with Abby. And when she said that, and it was like, yes, right? I mean, as pediatricians, I think we have a beautiful opportunity every time we're in an exam room, again, as a physician, to listen to our patients. And so I think this talk is such a great reminder of the importance of listening and the importance of being present, and the importance of really doing whatever we can to hear from the people that we're working with. So there's some great questions that have come in, and I want to have a chance to answer or have you kind of think with me about some of them. So one person asked, how do you find a neurodiversity affirming physician in particular? And is there anything about what they do or kind of how we're trained? The specific question talks a little bit about specific training for physicians in general, but I can say there's really not much of that. But any advice or tips for people to find a neurodiversity affirming physician or clinician?
Yeah, trial and error. I mean, no, I do think, there perhaps aren't, registries of these kinds of folks, but really thinking about and asking the right questions. And they may not even realizing that they are neurodiversity affirming, right? But if they are willing to listen and they will partner and they have a patient first, family first centered approach, then perhaps their practice is already neurodiversity affirming without them even really knowing what that means. And same for other clinicians and therapists. You know, we had several with Abby, and we talk about it being a good fit or not a good fit. And you know, so I think as we think about neurodiversity affirming practices, it's such a new term, that really you want to look about the qualities of the individual, and how they interact more so than, you know, a list.
Yeah, I agree. I think that makes tons of sense. So this question is about how do we balance a child's autonomy with what the parents want or expect from their child or for their child when those perspectives don't necessarily match. So that's going to lean into your mama perspective. But I think that's a really powerful question. And I think even for the clinicians who are listening, this can be hard. I know I've experienced this many, many times in my clinical practice where it's really hard to help a parent in this case um, kind of appreciate the ideas and the desires of a child. And so, what do you think about that?
Yeah, so two perspectives. One from a parent is, man, I can be a fierce mama bear. A lot of us autism mommies can be, but being an advocate for your child. But when that differs, your perception or expectation difference from that of the child. Like right now, Abby is 11, and we have a lot of sassy tone, and she doesn't hear it, and she doesn't know when it's appropriate to use it. And so our goals are different. And so we have lots of opportunities to discuss together what that means, how she's heard, those sorts of things. So I think that having an open and honest communication and dialogue with your autistic individual is really important. So that's the mama bear piece. The clinician piece is I have to remember that I am the patient's doctor, right? I am not the parent's doctor. I'm the patient's doctor. So, but sometimes the parents need the professional backing of the physician in order to understand the importance, right? Just like we have to parent neurotypical kids to understand what's an appropriate risk versus benefit. And sometimes I have to advocate for the patient and really, again, having that open and honest communication with checking your biases at the door, and teaching and modeling that behavior for your kids, for your patients, for your parents, is really important.
I agree. And I couldn't agree with you more. And so, um, so when we think about neurodiversity affirming care is where I'm going to go with this one. Um, how do you think about that in the context of the very broad spectrum? So everything from profound autistic people to folks who have a lot of speaking skills, because I think that as humans, we tend to bucket things, right? Like it's easier for us to kind of manage when we can put things in silos. But I often actually find it easier when we think about it um, more consistently across the approach. But how do you think about that? Because I guess for me, I think of neuroaffirming clinical care as applying to everyone in my practice, regardless of speaking ability or 24/7 needs, things like that. But how do you think about that?
Yeah, so in particular, when we're talking about, you know, kiddos who are profoundly autistic, may not have the typical communication styles that we know. Um, what do we think? How are they telling us what makes them happy and healthy, right? Us mamas have that intuition sometimes, right? Or we can recognize patterns of behavior. Behavior is communication. When are they cool, calm, and collected? You know, when are they eating better? When is their elimination better? So you just have to listen and differently. So it may not be spoken words, but I think that it's very important across the entire spectrum is to pay attention to all forms of communication, and putting that into a context of, you know, happy and healthy.
I love that. I think that's a really great perspective. What about thinking through this whole notion of language? So, person first, identity first, things like that. What if that evolves over time? Meaning, so the question specifically is there a way to hear the parents of a young child or young children who prefer person first language and then allow the family to revisit this? Later as they may adapt their own perspectives on the use of language. And so, I think the question is specifically about adaptability is how I'm interpreting that question, but what do you think about that, and how do you do that in your own
Mhm.
practice?
What a magnificent way to model flexible thinking, right? What an incredible way to think about adaptation and communication and reassessing needs and values. Um, it depends on the day for us and Abby, and that's okay, like, okay. And I mean, some of it is not getting caught up in the nuances. Again, I'm not a writer. I'm not a very right-brained, creative type of person. So maybe it's just my own perception and my bias because those words don't seem as particular to me. Like, yes, the words matter, but if that's what they want to do, then that's okay. Then we just, you just kind of have to let it go, and respect. But I mean, I really think what a magnificent way to model.
Yep, I agree. I love that. And I think that I wanted to kind of piggyback on that comment because frankly, a lot of what we are able to do as professionals is model. I can't tell you how often I'm modeling things. And I'm not like saying, okay, time out while I model, right? Like it's more in the way that I'm communicating with the individuals that are with me, whether that's the parents and how they're trying to, address a behavior issue, or whether that's with the kid as they're trying to learn their voice and where their voice can be applied or not applied. And so I think that again, for those that are listening and are in that clinician role or that professional role, what an amazing opportunity. I love that to demonstrate cognitive thinking, or I'm sorry, cognitive flexibility, and that thinking flexibility is such an important thing for all of us to think about and to do. So an interesting question came in about this idea related to diagnosis and potential exclusion from things like going to a different country. Or so the specific question is essentially, and I'll broaden this out a little bit, but essentially, are there things that you know about where people are kept from doing things like immigrating to a different country? Or one I hear a lot is joining the military when they have an autism diagnosis. And so just wanted to get your thoughts about that in the context of, we often are finding ourselves really shaping our conversations about neurodiversity in a very positive way, which is, I think, great. And yet there are some sad realities that still exist. And so what would you say to that?
Yeah. So, so many ways that we can advocate, right? But we're kind of stuck between this, like, what is now and what is our, ideal world that we want for our neurodiverse individuals. And so sometimes we have to be based in that medical model, and we have to be based in the reality. I think, yes, education advocacy is so important. But I also think it's important to keep the value, like what the intention is. So I had a mom the other day who wanted her 7-year-old reevaluated for autism because he didn't have it anymore, is what she said, right? Um, and in reality, I've been following him since he was born. He was an early diagnosis. He was in early intervention services. He has an incredibly supportive, amazing family, a great, care team at school. And they were just respecting who he was for who he was. And so he didn't have autism anymore because he wasn't having the meltdowns, and he wasn't, they were appreciating his differences, and he was feeling validated, and he was able to peacefully and, happily interact. So Man, it's hard when you think about other things about immigration law and you think about inclusion in areas like, military or certain universities or certain settings. Um, my mama bear in me says, well, then do I really want that kid in that setting anyway? If we want them in neurodiversity, affirming spaces and they're being excluded, then maybe that's our opportunity to have start the communication with that entity about what that means. And I think one of the other really good examples of this is neurodiversity inclusion in the workforce, because so many businesses are realizing how important that out of the box thinking um, is for business and technology and the arts and all of these other pieces. So it's making movement. We're there. So yeah, I mean, there's always going to be exclusion, but
Yeah, I agree. Thank you for that. And so, as we wrap up our time together and we get ready to start with our next speaker, I just want to thank you, Maya. As I tell you often, I learned so much from you and Abby. I honestly think Abby is one of my best teachers, truly, along with many other autistic kids. But Abby in particular has in a really incredible way of sharing her perspectives. Again, love the idea of sitting under the table, right? Like, I just love it. And so sometimes it just takes those subtle understandings of someone else's perspective to be like, oh, yeah, maybe I am the rigid one, And so certainly, I think we can all learn a lot from Abby and many people like Abby. And so thank you again, Maya. I'm really, really honored that you were able to be here and share your important information with us. So I'm going to switch gears and I'm going to welcome our next team to talk with us about behavior as communication. So Katrina Davis is actually going to do the introduction for Dr. Sorensen, but I also want to just take a second here to remind us all that we are well aware of the broad spectrum that we serve, and that the broad spectrum includes many who have profound needs. And so I think I don't want anyone who's listening to think that any of us in eco-autism are blind, submissive, or dismissive, any of those things to those real, raw, powerful, important needs. And like I said earlier in my opening comments, we look at this as a longitudinal opportunity. Every year we do our symposium. Every year we are doing thousands of hours of professional development for numerous people around the world and different types of professionals. And so I would say it's on all of us to better understand the breadth of the spectrum